Okay, welcome everybody. My name is Andy Judge. I am the co-chair of the Cancer Cachexia Network, which is the patient and advocacy arm of the Cancer Cachexia Society. And I'm joined today by Dr. Jose Trevino. Dr. Trevino is the Jeffrey Schutz Chair in Pancreatic Cancer Research, the Walter Lawrence Jr. Endowed Chair of Oncology, Director of the Pancreas Program, Chair in the Division of Surgical Oncology, Professor of Surgery and Surgeon-in-Chief at Massey Comprehensive Cancer Center at Virginia Commonwealth University. And Dr. Trevino has agreed to join us today to discuss his role as a surgeon in a cancer patient's journey. So Dr. Trevino, thank you for joining us today.
Thank you very much, Dr. Judge.
And so before we jump in with some questions, perhaps you could just share with the listener the role that you play in a cancer patient's journey as a surgeon.
Yeah, so I'm privileged to be the division chair of surgical oncology here at Virginia Commonwealth University, Massey Comprehensive Cancer Center, and what that means is that I kind of oversee all the surgical programs in oncology. Personally, I have a very kind of unique role as being a pancreatic surgeon here. But I do obviously see a ton of other cancers through my partners and the people that I practice with and my staff. So yeah, it's an interesting time. It's an interesting kind of era in the sense that we're now looking at cancer a little bit differently. And so when we see patients in our clinic for surgical resection, obviously there's a lot of things that come into play. And the number one thing is how can we improve the quality of life of these patients, but also include the quantity of life. And I think that's where the idea of cachexia and how that affects people's quality of life and even clinical outcomes is incredibly important. So, in brief, we see patients with cancer all the time, and our overall mission is quality of life with an increase in quantity as well.
Great. So you touched on something there in terms of quality of life and length of life. So how do you see cachexia impacting a person's quality of life?
I'm going to be very specific to pancreatic cancer here because it's near and dear to me, and it's the one battle that I fight every day. And obviously, 80% of patients with pancreatic cancer will develop some form of cachexia along their path, and so it's incredibly impactful. So what does cachexia mean for us on a clinical level? Well, it means that a patient who starts losing muscle mass will lose their strength. And as you can imagine, that a person that doesn't have the strength to even get out of a wheelchair or come into our clinic, or and in some cases breathe, right? Because these are all muscle groups, will not be able to afford any form of therapy, let alone surgery. So systemic therapy, chemotherapies, radiation, and then as I said, surgery are not going to be something we can offer them. And the rationale is really simple. And I tell patients this: if my therapy kills you before the cancer does, what's the point of my therapy? And when patients come into the clinic very weak, you can imagine that any form of what we do, and that can include chemo, radiation, or surgery, can actually decrease the amount of life a person can have. And so it's incredibly important for us to assess their performance. And a lot of medical oncologists call this performance status, which pretty much means that how strong are you, how active are you, how capable are you going to be able to tolerate what we're going to give you. So yeah, cachexia is huge. And it's kind of interesting though, because it wasn't until recently that the Cancer Cachexia Society and others, and when I say recent, over the past decade or so, really started getting momentum, where people started to pay attention to muscle biology and how that affects patient outcomes. And so if you were to ask me my brief opinion, I would tell you that without having good muscle mass and good strength, our outcomes, regardless of what we do, are not going to be as good as they can be.
So is there one that's more important than the other there? You talk about muscle mass and strength and function. It sounds like you're putting a lot of emphasis on the function side of things. Is that perhaps one of the most important variables?
Yeah, I would like to believe that's one of them. But at the end of the day, it's really, a whole physiologic system, right? And so muscle does more than just provide us the ability to move and breathe and do things like that. I mean, there's protein involved. There's sources. There's cytokine releases, there is a ton of things that I think lead us into a homeostatic component when it comes to muscle biology. So, I'm not a muscle biologist, and so the things that I do know are limited to my clinical practice and the things that, we research on a kind of on a macro level more than micro. But at the end of the day, it's a part of who we are. And so when I deal with patients with cancer, unfortunately, their homeostasis is off, and muscle is a contributing factor to that. And so, we talk about sometimes in the cancer world about the tumor microenvironment, where the tumor lives, its home. And and for me, it's kind of a yin yang. There's positive components to that, but there's also some components that have been hijacked and become negative components by the cancer itself. And while muscles is maybe not considered part of the tumor microenvironment per se in the local area, I think it also can be hijacked and also can also contribute to the systemic changes that can lead to in some cases bad outcomes. And that's why the research in muscle biology or cancer cachexia is incredibly important, because that's going to give us some idea as to how muscle might be contributing to either cancer progression or in some cases cancer regression or cancer control. And it's for us to investigate it and know.
So, given the importance that you're clearly articulating about cachexia in a patient's journey and their ability to tolerate surgery and the recovery, is cachexia something that you or your healthcare team discuss with patients and their families?
All the time. So when a person walks into the clinic, a lot of things I look at. Obviously, I look at the clinical status. Are they rolling in a wheelchair? Remember, right? Can't get out of a wheelchair. They're not going to be able to tolerate the surgery that I perform. I look at them overall, their condition, their ability to breathe, right? Whether or not they need oxygen, whether they're heavy breathing or not. Can they take 10 steps without getting short of breath? Back in the day, and this was 40, 50, 60 years ago, I happened to have been in the part of a hospital which was in Chicago called Cook County Hospital, which the surgical clinics were on the second floor. And it said at the door when you were walking into it, it said, to get to the surgical clinic, you must take these steps. And interestingly enough, they would have the surgical patients walk up the 2 steps, and then right when they came out the door, they were in the reception area, and the receptionist would actually document the level of breathing and whether or not you had to stop every 3 or 4 steps after those 2 flights. And that was an important tactic for surgeons to know back then whether or not you would do well from a major surgery. And in reality, that is true to this day. That people that do not have good muscle mass, good muscle function, good muscle physiology, very likely won't do well. Because remember, right, so at the end of the day, these patients have cancer, and the cancer is trying to eat up a lot of the protein stores. And in some cases, when it runs out of the usual protein stores, it's going to attack the muscle. Mm-hmm. And cancer will debilitate the muscle to a level that could debilitate the patient to ultimately lead to a really bad outcome. So there are a lot of areas that we need as practitioners to pay attention to when it comes to that. Now, that's just visualization, but we also have some clinical parameters that we get out of the blood, as well as the radiographs. In other words, the imaging that we perform to look at the cancer, to stage the patient, to see where the cancer is gone or not gone, and ultimately, in some cases, even look at the muscles. So there's a lot of radiographic imaging that can give us an idea as to what the muscle is doing. And I'll tell you that if I look at a radiographic image and I see a ton of edema at the muscle level or a lot of atrophy in certain areas of the patient's body, then I'm going to be very hesitant before I put them under heavy surgery or big surgery or big systemic therapies.
Sure. Yeah. So with that in mind, then, are there any realistic activities that people can do prior to surgery that can help improve their functional capacity and improve their ability to recover?
Absolutely, absolutely. And in a perfect world, right? In a perfect world where we would have all the resources available to us. And mind you, I do believe that this is coming over the next 10 to 20 years, where there are going to be prehabilitation programs for patients to undergo surgery and therapy. And let me tell you that it's not going to take a rocket scientist to figure out that people who allow the prehabilitation to get stronger before they get chemo, radiation, or surgical approaches will will do better. In the long run, when they're even compared therapies alike, will do much better. And it's just intuitive. It just makes sense. The stronger the person, the better the outcome is going to be. Now, why do I say that? Because if you're stronger, you'll be able to tolerate the therapy longer and in theory, do much better. And I will tell you, this is an incredibly exciting time because of the fact that we have now got clinical trials up and going for for cachexia, right? There are clinical trials out there looking at these drugs that will try to maintain the muscle mass. Kind of the opposite of what people are trying to do nowadays with trying to lose weight. They're the anti of that. Sure. And they're up and going, and we're really excited because here at VCU and Massey Cancer Center, we're about to open up one of the stage 3 trials, and so clinical trials. And so we're excited to see whether or not that's going to work in advanced pancreatic cancer, to see if we can't maintain the muscle mass, maintain the weight, maintain some parameters of nutrition, and ultimately get them through the therapy. And to make this even more exciting is the fact that there's a new drug that just came out about 6 months ago, presented at ASCO approximately 6 months ago, that is now extending the life, significantly extending the life of patients with metastatic pancreatic cancer. So what a time to really have developed new targeted therapies for the cancer on top of new therapies to try to maintain muscle mass. In my mind, that if these two trials combine together, the idea of long-term survival can be a reality for patients with advanced pancreatic cancer where a year ago we would say they have no hope.
Yeah, that's a good thing to touch on there in terms of, I guess, multimodal therapy, right? That people are now figuring out how to target the tumor better, but also treating the patient. And so in terms of that, you touched on some things about clinical trials starting at your place. What do you think it's going to take in terms of cachexia is such a systemic disorder that there's a suppression of appetite, there's loss of muscle, there's loss of fat. What would the best therapies be able to hit on, you think?
Yeah, I'll be honest with you. This has got to be have to be incredibly multidisciplinary, right? There's an incredible psychological component to some of these patients. There's an incredible physiologic component for some of these patients. There's a lot of things that we're recognizing: cardiac function, pulmonary function. I mean, you can think of everything, including muscle mass in general. And so in a perfect world, like I said before, these prehabilitation programs will have a nutritionist, they'll have a psychologist, they're going to have a muscle physiologist, somebody, and a trainer, almost a physical trainer to some degree, a cardiac oncologist, right? And if you think about this and you get this kind of moving, these patients that come through the door that are going to undergo these therapies, this could be an incredibly impactful way of looking at things. I do not believe there is going to be one magic pill for this whole situation. It has to be, a collaboration of beings like yourselves, myself, and medical oncologists and others that come together to work in this. Because that truly is going to be the way we're going to extend people's lives.
For sure. Dr. Trevino, I hear the great hope in your voice and excitement that the future of this area in terms of cancer treatment, in terms of cachexia treatment. I think that there's great hope for patients in this space where there perhaps hasn't been in the past. By way of parting, what words of advice could you have for patients and families in terms of trying to tackle this challenging condition?
Yeah, at the end of the day, I tell the same thing to my patients all the time. There's three things you really need to do well when you get diagnosed with cancer. And number one is that you're mentally fit, right? You have to be psychologically ready for what's going to happen. You have to be positive about what you're going to be doing and moving that forward. Two, I always say they're spiritually fit. You got to believe in something, right? Believe something greater than yourself. Believe in God, believe in Jesus, Muhammad, Gita, Buddha. It doesn't matter. Believe in something so much greater than you to allow you to go through this. But most importantly, on top of those two being incredibly important, tied, let's say across the three, is to be physically fit, right? It's incredibly important to be physically fit for this. And so people that are physically fit, not only psychologically fit and spiritually fit, do really, really well. And while I don't have any objective evidence to demonstrate that today, I mean, these are the things that I think are absolutely critical for this. And this is the time, like especially in this year, 2026, with the newer data on some of these more advanced cancers, I mean, this is the time for us to really start pushing the quality of life of these patients to improve their quantity. And with these drugs and everything that we're doing as a cancer cachexia researchers and investigators, I think we are big components of that physically fit part. And so if you hit that one part and then we hit the biology and the others and the psychological components of the others, I mean, there's no end to the positivity we can bring to these patients and their families. And so it is an exciting time, and I'm happy to be here for that.
Fantastic. Well, thank you for all that you're doing for patients and their families, and thank you for your time today and sharing your expert opinion on this important topic. So really appreciate you, Dr. Trevino. Thank you so much.
Thank you very much.